Well, it is Monday, June 15th, and I had a little trouble here with my connection. I'm not sure why, but we got it settled. So, welcome today to AP Monarch Designing Healthy Environments. I am Alicia Ponce, the founder and principal, where we design healthy environments for you, for Earth, and for all. So I'm excited to be speaking to Victoria Navarro, who is a dear friend over many years, and currently she is the regional director in the planning, design, and construction department at Advocate Aurora Health, where she has been doing an amazing job, being in the healthcare sector at this time of a pandemic has been really interesting. And we're going to hear what she has to say. I'm going to read a part of some of her impressive bio here. So, as I mentioned, Victoria Navarro is a regional director in the Planning, Design, and Construction Department at Advocate Aurora Health. Advocate Aurora is the 9th largest not-for-profit health system in the U.S., and they are serving communities in both Illinois and Wisconsin. They have a comprehensive array of healthcare resources and access points. Advocate Aurora has a broad portfolio of offerings from primary and specialty care to hospitals, pharmacies, laboratories, and home care. So when I read that, I imagine, how they were able to accommodate, their patients and their staff during this pandemic. Imagine, they have 500 locations, including 28 hospitals, and is among Illinois and Wisconsin's largest private employers with more than 77,000 employees and providers. Could you imagine, pivoting all of those employees? And we've talked previously, and she said that a lot of the employees are working from home, and so now they too are looking at options of, who stays at home. They're just like all other organizations, we're taking surveys on, can we make this work at home? And what that says to me as an architect, and to organizations. Now they have all of this square footage, right? A lot of the spaces are leased. So maybe that's they have to consider and weigh in all of those factors. How do their spaces fit in for leasing? And where do they start investing their money? Do they invest it in real estate? Do they invest it in new construction? Do they invest it in other areas of the hospital? So we were talking the other day, and she said one of the things, because of the pandemic, they are now going to invest a lot in wayfinding and plastic shields, because the surveys show that plastic shields really give patients and staff that level of comfort. And I'm not talking the face shields that we've seen. We're talking the shields, at the counters, at the registration and so forth. So they are going to invest a lot in that. We're going to see a lot of the shields in the counters, where actually she shared with me they're going to invest $1 million in plastic barriers alone, and you'll see a lot of social distancing signage like floor mats and footprints, and also strategically placed in the chairs in waiting rooms as well as you walk in. Waiting rooms is yet another area where they're looking at because of, the pandemic, is that they quickly were able to move into they have an app. They have an app now into a telehealth, way of operating. So, yay, we have Victoria joining in. Let's see Navarro. Can't wait to see her. Hello.
I didn't think we were going to be able to do it.
I don't know what happened. Well, I do. I can take a guess. It's probably my phone, and I don't know. It was acting up a little bit last night. I noticed it, but we tested it yesterday and it worked out fine.
Yeah. But I kept going on to the other invites and I'm like, where is she? So and then I checked back, so I'm glad we got on.
Yeah, so it's so good to see you. I've already introduced you, but I can briefly do it again. Welcome everyone, and thank you so much for your patience while we, got connected. This is Designing Healthy Environments with AP Monarch. I'm Alicia Ponce. We are architects and sustainability consultants where we design healthy environments for you, for Earth, and for all. And today it is my pleasure to introduce Victoria Navarro. She is the Regional Director in the Planning, Design, and Construction Department at Advocate Aurora Health. And what I was thinking when I read, what you do, I just can't imagine what the last 3 months have been for you, because healthcare, you needed to function and, serve all of these extra patients, keep everybody safe, keep everybody comfortable. And so I'd like to hear a little bit about what that has been for you and how Advocate Aurora has dealt with that.
Sure. Well, first of all, thank you so much for having me, Alicia. It's so nice to see you again and have this conversation this Monday morning. And I would love to share my perspective and what happened during the COVID crisis. And certainly my role in it was as trying to help get the capacity increased at our sites. And it was really all the caregivers, I think, that are the heroes here. But I can share from my perspective, we had to help get initially the trailers set up at each of our 27 hospital sites so we have 27 hospitals across Illinois and Wisconsin. We're the 10th largest health system, integrated and non-for-profit in the United States. And we had to quickly set up these trailers to do the testing for COVID. And at that time in mid-March, it was a shortage nationally for the testing kits. So within a week's time of setting this up in a lean fashion, a modular trailer set up across each of the sites, we were told, hey, we've got to pivot. We've got to go and now set up for the ED tents. And in our emergency departments, we are seeing a lot of patients present with symptoms, and some were well worried patients that were wanting to get tested. So we had to find a way to manage that very quickly. And what we did was we set up tents in the parking lots adjacent to the emergency department.
Okay.
This way, patients that were presenting with at least an upper respiratory infection or one other symptom, they were asked to pre-register, go through the tents, and then be triaged to either go into the hospital or continue with care within the tents. So depending on the size of the hospital site and the community we were serving, we had different pods of exam room bays within that triage tent to get through serving our consumers in that way. And then at the same time in the hospitals, we were experiencing a surge. So we had to quickly get each of our facilities assessed with their existing conditions. So understanding, are they set up for, more than one patient to a room? That was one of our strategies,
Mm.
doing double occupancy. Is there enough space to take the equipment in and have two beds in a room? So we were looking at that first. Then, as our ICUs, our intensive care units, were starting to also overflow, we started to look at other areas like a prep recovery by the surgical services or procedure rooms, and determine how are we going to make all of these rooms convert into additional COVID units. So all of
Mm.
that was carefully coordinated. We had a central surge ops command that led and drove a lot of the decision making, and gave direction, which cascaded to all of the sites. And every time we had to escalate from one level of surge to the next higher level, because there was continuing to be a huge, uptick in the COVID patients that we were seeing, we had to coordinate those permissions to move into different areas. Some of the other areas that we looked at studying for surge were in our ambulatory surgery centers. So most people know that we stopped taking scheduling for patients that had elective surgeries. And those clinics were then open, and they continued to serve in a couple of different ways. We ended up having to do a lot of COVID testing for our own team members, our own healthcare providers
Mhm.
that were coming down with symptoms. They were on the front lines and getting that exposure. So we were testing them before they were coming into work. And then we ended up converting some of those alternate care sites into community testing sites. So
Wow,
it
amazing.
really evolved. And now, last week, we opened up our first mobile testing trailer that was parked by the Ashen Baptist Church in the south side of Chicago. And I think that that's the key here, is really just trying to stem that spread of the virus and get the testing, provide that access to our underserved communities, and just increase that knowledge for getting tested, quarantine,
Mhm.
and
And what I was thinking also, when as you're doing this, you guys were also talking about, obviously you have to take care of your staff, and you
yeah,
went to remote work. You were doing this simultaneously. So what does that look like
yeah.
now? And what are you talking about in the future?
Well, you touched on the caregivers. So we not only did we provide remote work, but we had to provide for the family, for caregivers that had family members or they were working round the clock. We did create respite areas in the hospital. So the areas
Mm.
where they could take naps, a 30-minute duration nap during their shift, get some sleep, and that we provided cots and recliners and soft lighting. So those kinds of amenities were so important, because we needed to give everyone a break and a chance to refresh and recharge. So that was definitely something that we did within the hospital. Remote work was for our non-essential team members. So we are in this process of enacting a remote work policy, and needing to think about things like your computer, and taking your office equipment and your office supplies to your home setting, so that you could be able to work remotely. And then we are looking at just how do we compensate everyone for some of the things that they're having to deal with, whether it's cell phone charges or supplies. And then some of the challenges, I think, dealing with everyone just from a mental health perspective is really, how does everyone stay resilient and manage to
Right.
have children at home, that the schools or daycares were closed? How do you balance working and their schooling in an electronic way, and how do you balance not being able to interact with each other and get that support? So we're trying to be ahead of that, and I'll always bring that to a discussion and making sure that we're checking in with each other. We're doing the
Yeah.
things, and we're trying to really support all of our team members in this new way.
Yeah, and so the way I came to think about it and just recently is that everything in our lives merged together, for those of us working remotely, but also in your clinics and hospitals, all of the everything just merged together and you had to figure it out. And so you had to figure out, COVID patients. You had to figure out your regular patients, scheduled patients, your staff, the respite, and then learning how to find those areas in hospitals. Like you also mentioned, in an earlier conversation about the cafeterias as well.
Yeah.
And so I was asking, I'm curious about during this process, is there anything like you wished the hospitals were equipped with? So, for future reference, like, wow, I wish, the cafeterias had like, I don't know, rotating walls or something so
Yeah.
that we, equipped with the needs that you need.
Yeah. No, that's a really good observation. I think those are some of the greatest lessons learned. It's just how we can adapt our facilities to be very flexible and
Mhm.
think about multi-purpose use. And that flexibility, that adaptability quickly in a pandemic or any kind of crisis situation is key. While we didn't have medical gases for in our waiting rooms, or we didn't have
Uh,
in the cafeteria, um, some of the negative air or separation of barriers, we are able to look now at modular solutions and solutions to put up very quickly temporary
mhm.
barriers, and understand really that workflow and how to take some of our spaces to create them to better serve multiple patients, like in a COVID units scenario. We're looking at our negative air pressure rooms. We're looking at where even our supply chain. How do we get all of the personal protective equipment, the masks, the face shield,
Mhm.
scrubs, all of that set up? We needed a lot of FF&E, so the furniture, all of the equipment that dealt with taking in patients, all of that was something we had to pull together to furnish
Mhm.
in tents and in those double occupied rooms, or even in settings where we had multiple screening. And that's what we're looking at now is as patients are coming to the sites, we're starting to reactivate those areas, whether it's the cafeteria or the front entrances of our hospital sites. They're welcoming the patients that are pre-registered, because we're really encouraging using our Live Well app, the Advocate Aurora
Mhm.
Live Well app.
Okay.
Check in and register, and then that way it's a minimal interaction of screening. They check your temperature, they ask you a few questions, then they give you a mask if you don't already have a mask, because it's universal masking is another safe
Mhm.
part of our safe care process and safe care promise. And then we bring in the patient. And even before that, I think I heard when I got on, I heard you talking a little bit about how we've eliminated really waiting in the waiting room. And we ask that you wait in your car, and we can come. We know with the app that you've arrived. So we're leveraging that GPS or that real
Wow.
time, communication. We know that you're in the area. We know that you're in the parking lot. We ask that you wait, and that's becoming really what we're calling the patient lounge.
Yeah. Well, we have a dear friend of ours, Rada from Rada
Hi.
Architects, Rada Deutscheva, and she asks a really great question that, we're all thinking about not only in healthcare but in all other areas, talking about like efficiency and real estate,
Yeah.
as we consider remote work as we consider all of these things, and as we consider capital budget, where do we start? Where do you start investing your money? So she asks, which spaces in a hospital lend themselves best to convert quickly in times of change? What are your thoughts?
Yeah. Well, when there's times of change, but then I'll address first with COVID. What we did in assessing our facility planning was looking at how to keep the sickest patients, and especially the
Mm-hmm.
COVID positive patients, within the four walls of the hospital, especially where they can be closest to where the caregivers are, the medication, all of our supplies, and really isolating them away from exposure to other people. So when we looked at that, the operating room was definitely a space where we thought we could create beds for 4 to 6 patients and keep them isolated. The prep recovery and the PACU bays within surgical services are also able to be easily converted into areas to treat COVID patients. In addition to, again, like I said earlier, optimizing a patient room to have 2 beds. Now, not everybody, we're into the single room occupancy and privacy. And I think if you can dedicate, as you're thinking about retrofitting or even new construction, if you can dedicate a unit that can have negative air pressure, have a separation, I think that's the easiest. And then in terms
Mm-hmm.
of what we're doing with other spaces, multi-purpose rooms that can have the teleconferencing and telehealth capabilities, because we're moving more and more in that direction of care through virtual devices. That is key to create that
Mm-hmm.
opportunity. And we're seeing that, with the remote work, with the electronic health records, and being able to use your digital device, we don't necessarily need as much real estate. We're taking a look at that opportunity to
Mm-hmm.
try to optimize spaces that we own, minimize where we're leasing, and look at ways that we're being as productive and as efficient, even working remotely, and providing those touchdown spaces, those shared collaborative spaces, more than just single offices taking up
Mm-hmm.
square foot.
Yeah, and that seems to be a question, the million-dollar question, or what is the solution as we move forward? Like, what's going to happen with all the real estate? I think I read somewhere, it was 2 weeks ago, that like Facebook, for example, for sure, all of their employees are going remote. I read a headline, and so that's a lot of real estate. I think they have a whole campus, dedicated to Facebook employees. So it's just something that we are considering as well. And we also talked about like surveys and how do we maintain these spaces. When we do programming and planning jobs for our clients, one of the main things that always comes up, as it should, is the patient or visitor experience, and also the staff experience, how to optimize and enhance it. That's first and foremost,
Right.
right? And then we are also talking about efficiency of space and being very intentional about where you're spending your capital money. Where does it make most sense? So all of that is wrapped up
Yeah.
into one. So you talked a little bit about your surveys as well, and how you stay engaged, how you have been staying engaged with the people that you serve.
Right. So we are a consumer centric organization. So it means a
Mhm.
lot to us that they're satisfied, that they have a positive experience. And we conducted consumer insight surveys to really understand, from a safety perspective, what is their perception, what has been their experience. And we could go, and put all these barriers, and take out all the furniture that have fabric on it, and do all of that, but let's do it in a very purposeful way and understand. So
Mhm.
based on data, based on a survey that we did in our communities of our patients, we tried to understand different scenarios of what it's like, with their first impression. So when they're greeted by someone at a reception desk or a registration desk, and they're wearing a mask and a face shield, and there's a plexiglass barrier.
Yeah.
How does that make them feel? It's that fine balance of making it feel welcoming and safe and friendly, but also not so intimidating and scary. So we wanted to understand, is there value in adding a protective barrier and
Mm-hmm.
having the caregiver on the other side of that barrier wear all these protective gear? So what we learned, what bubbled up to the most desired was wearing a mask by the caregiver and having a protective counter shield. So
Okay.
you can imagine all of our existing facilities are in different levels of modernization, and there might not be space for all the things we want to do with signage and barriers. So we had to come up with a solution to retroactively put these barriers not only at the front reception desk, but you can imagine the cafeterias, like you were talking about, desk. We're looking at it from a rehab standpoint, maybe in the infusion bays, team members'
Mm-hmm.
workstations, maybe in the call centers or shared offices where there's a lot of people congregating in one space. So besides the social distancing and some of the things that we've been doing, is really studying also our marketing and branding. And we've created these
Mm-hmm.
floor mats that have, the footprint so that they're spaced 6 feet apart and people know where to stand on top of those mats. It's those reminders of social distancing. We have, we obviously don't have a lot of space to store if we were to remove all the furniture and seating within a waiting room. So we put straps and this really effective signage that really keeps the chair in place, educates someone about it, and then really promotes that social distancing, the enhanced cleaning, all of that is encouraged. Our signage and our safe care promise.
So times are so different and interesting. I keep telling, my kids is that we're living in a truly historic moment, right? And, trying to get to record and how do you feel about this? We can't see our families or can't touch, but, so interesting. But, I wanted to sort of transition into another topic that's related, but I wanted to get your insight on this experience that a friend of mine had, and as a result of the pandemic and what communities it has impacted the most.
Yeah.
So my friend, he graduated from Ivy League. He was doing policy work in Latin America, and for various reasons, he came back to Chicago right before the pandemic, and he lives in a little village community of Chicago, and it's a low-income community. But he wanted to go get tested, and so he looked up online where was a testing site, and he found one. And because he's very active and healthy, and he walks there, or he probably ran there, and he said it took him 35 minutes to get there on foot. And when he got there at the testing site, they said, I don't even want to test you. And he was taken aback, and he was actually featured on NPR with this story, because what he did then is he opened up a testing site in his community, free testing site, so that people can be treated, fairly and equally with the care that they deserve. But he was just really confused as to why they told him this. And he says, is it because what I was wearing, because how I look, or why was I told this? So, I mean, what has been your experience? And the reason why I ask is because this COVID has really affected the Black and Brown communities highly, the working class. So I'll let you hear your thoughts.
We're addressing this, Alicia, I'm Asian American, and I
Mm-hmm.
have that experience of just understanding health, disparities and disadvantaged communities. And it's absolutely important to address that racism is another pandemic in addition to the
Oh,
COVID-19.
yeah.
And we need to understand how toxic it is and how it's a great risk factor. Racism is the root of a lot of what we're finding with health inequity. So some of the things that we're doing within Advocate Aurora Health is, like I mentioned, the community health testing. I've been part of some listening sessions with our communities, our faith-based communities, in the Latin and African American communities that we serve, and understanding how are they going to educate their families or their employees and reopen their facilities. How are they going to prepare from a cleaning, sanitization, disinfecting, and just be ready for business again in this new world. So again, just spreading that education, I think, is important. We're also developing culturally appropriate materials, partnering with those communities again to expand our outreach. And we are doing digital and print ads, doing all kinds of public service announcements from our leaders to get word out there about getting tested, quarantining, and those that are COVID patients and they are recovering, we are delivering and distributing symptom relief kits. So again, continued education on on sanitizers, safe practice with wearing masks, and
Mm-hmm.
just trying to help give them healthy living tools and resources to address the social determinants. And for whether it's food, housing, education, access, transportation, all of that, including your mental health and behavioral health, is
Right.
so key
Mm-hmm.
to understanding health equity and getting the disadvantaged communities the help that they need. And I think what we really need to do is just continue to have dialogue, understand as designers and architects, what can we do to be a part of the solution from a programming and designing standpoint,
Mm-hmm.
to encourage that full holistic health? Is it creating in a community not only your healthcare facility, but a community center that might continue to educate on healthy eating, on how to manage your mental health, on exercise and fitness. All of that, I think, is key, and it's bringing that kind of service to our communities that are underserved and getting disadvantaged care. So I think all of that is really an integrative approach and
Yeah.
help as we think of the future.
Yeah, I've said this before, but even with why I'm so just intentional or so passionate about green building, it's because it's taken me down this road to understand the big picture, intentionally understand it, because in green building we now have, requirements that we must meet on equity, right? We have to intentionally look on equity. Is it just pay? Is it just, equitable pay, equitable training, and equitable team, right? A diverse team. And a diverse team could mean, okay, let me select different looking people, but I think we should also do about acceptance. We can do diverse because we are diverse, but we can also accept each other. How do we know that we accept each other? And so with green building and designing these healthy environments is that we look at all of that. And, with the certifications, it's third party verified. It means that we have to document it. It means that we're taking action and we're doing it. So thank you for sharing your thoughts. And I saw something, for those of you who may not know and are watching, Victoria and I have known each other for about 20 years. We met at Northwestern Memorial Hospital while working on the Feinberg Pavilion, right? doing punch lists, I think.
Yeah, we were, and I want to show you how we celebrated, You might
Okay.
remember this dinner.
Oh my
So there's
God.
Maria,
Look.
and there's you, Dawn, me, and Dave Archer, if you're listening. But we were
Oh,
so young. Look at us. And
wow.
this was celebrating the opening, I think, and the completion of Prentice Women's Hospital. So yeah, and then
Wow.
that one,
I love that
I
picture.
know, and a shout out to Bob Dybus. You came when I was so young. I had a birthday party, but there's Alicia and there's me and there's Bob. But yeah, so good to
So,
see you, and I'm so happy that we could connect on your Instagram Live program. You're doing
yeah.
great work, and I applaud you. And hope I can come back in another time and reflect and continue to share our experience.
Well, I would love to have you back because we could keep talking about this. And one more, I read something last week that you were selected as a 2020 Woman of Influence by Kira Lanford of Milwaukee Business Journal. So, I mean, I love this. So you're doing an awesome job. This is a prominent list of community leaders throughout southeastern Wisconsin. And so congratulations for, being listed as one of these women of influence, which,
Thank you so much.
amazing.
Yeah,
Yeah.
yeah, I'm just trying to voice my truth and do what I can to help others make a difference and really rise up everybody, help everybody get better. So thanks again for allowing me to have this time with you.
Oh, thank you. And Rada has one more note here. She says, wealth of information and tons of caring, for sure, from another amazing architect, female architect. Yes. And so I just want to say thanks again. And we will be able to watch this on the Instagram show on AP Monarch. And we will post it on LinkedIn as well, so we can watch it in various formats. So thank you for being patient, but we got it done.
Have a good day. Bye bye.
You too. Bye.